Hi, everyone. So we have my name is Val. We're Rant with a Purpose, and we have Dr. Neil Pitts here today with us. He is a longtime mentor of mine. I really looked up to him. I'm going to let him talk a little bit about himself, but he really is the reason um, of how I joined Miriam Medical Clinic and also just part of the reason why I'm just so passionate on public health. It's all because of him. He coordinated everything, all the activities that I physically have to show up and be there as related to public health and being in the clinic. So Dr. Pitts, we'll let you start out with say whatever you want to say. Introduce yourself.
Well, hello everyone. So I am so glad to be in this space, and Val is very kind. She's being very kind. She comes with a passion all her own, and so if there's anything I might have done in order to sort of like uh, shepherd her along by bringing her into Miriam, I am so glad that that has happened. But yeah, Val has a passion that is deep and is inspiring to all of us. Um, so yeah, my name is Dr. Neil Pitts. I'm a doctor of pharmacy, and I'm a co-founder of Miriam Medical Clinics, and I am the current president of Miriam Medical Clinics board of directors. And Miriam Medical Clinics, you probably heard this before if my colleagues have spoken. We've been in operation since 2012 and have moved around a bit through various homes in North Philadelphia and now in South Philadelphia. But our mission has been to really provide health care for those who have had challenges with health care along the way. Not having a good fit with their physician, for example, not being heard, not being seen has been a huge challenge in healthcare, and so we're trying to um, sort of fill that gap, close that gap, if you will. Um, and I come to this by having a passion for public health, as Bao has stated, because there are so many issues in healthcare as to why patients either are not satisfied or patients just are are not being are not really realizing the health in America that they should realize. There's a disconnect between patients and providers, and a lot of it has to do with it's naturalistic causes, right? So we've evolved into a nation whereby individuals are really rushed. Um, medical providers, and patients are not are not outside of that loop. Certainly, we're all rushed, and none of us is exempt. But Miriam Medical Clinics really wants to set a new standard, and we want to make sure people are allowed to tell their stories and to indicate what their social determinants of health are that contribute to their whatever physical manifestation they're going through. And it could be hypertension, it could be diabetes. But we are trying to combine good public health practices with uh, evidence-based medicine, and then also a vision for that patient reaching whatever personal or physical or spiritual goals they might have that are being prohibited by their good health, by not having good health. So that's sort of uh, trying to be a nutshell summation of what Miriam Medical Clinics is about, and providing some context to Miriam Medical Clinics.
I have to say that you summarized it quite perfectly well. I think what you said in the last 3, 4 minutes was what we try to do in our hour-long episodes previously with Dr. Johnson. And, so we've heard of, Dr. Johnson's passion, how he originated, and how he has come to want to pursue more in public health because I've mentioned in previous episodes that the two of you have a full-time career outside of this clinic. And then you also dedicate a huge portion of yourself to the clinic as well. So this is kind of like your extracurricular, even though you yourself, what you do in your current career is related to public health.
Yeah.
And I think for me, after seeing the two of you, so experienced and still after so many years, still have that, passion for like, just running around and trying to do more. It's really inspired me to feel like I need to do more. I can't just,
Mm.
yeah, hey, I'll put in, a few hours a month and then call it a day. I feel like I have to do more. What else can I do to make that impact? So I think that the two of you have been really my inspiration, and along with some other folks as well, from other nonprofits too. And I think just seeing just the work that you are, doing makes one think that it is possible. So I wanted to see, what is your inspiration to just get up and do this day after day? Because for me, my inspiration is you. So what is your inspiration? It can't be me because I came after you. Um, so I mean, just talk to us a little bit because some folks may not feel inspired, right? They may feel
Mhm.
like this is you're seeking a bottomless pit. It's like, it's never going to end. Well, yeah, for me, it's just seeing the difference in one person
Yeah,
really
yeah.
motivates me.
No, no, I hear you, and so in that regard, I've lived a um, very hope-filled life, right? So that I come from a service background. That is to say, I've been related to either by blood, or some other relationships that I've had in life. Pastor of church, other mentors in my life, whose it seemed to me whose sole purpose was to serve, and whose sole purpose was to see that their 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 fellow travelers, as we might put it, just to make sure that our fellow travelers are having a good quality of life. There's a lot of suffering in the world. Some of it is more tragic than other parts of it. Some of us are exposed to more tragedy and suffering in our lives than perhaps others. The truth of the matter is, we all have a burden that we carry. And so I think for those of us who have um, who have seen opportunities where we can serve, to move forward with those opportunities. I mean, my inspiration really was one of my pastors from my early journey, my early life, Reverend Dr. Leon H. Sullivan. He was a pastor of a church that I belonged to since life. And through Reverend Sullivan, I have seen some what one might call miraculous things happen in terms of um, opportunities for African American where there were little opportunities for African Americans. I've seen the change of the tide, as it were, with regard to racial relationships. And I think that all of this, has inspired hope for me that change can happen, right? And if we look at the state of healthcare now, uh, healthcare is a mess. And, we call it what it is. It's absolutely um, dysfunctional, really.
Mhm.
And so, and one might look at the state of healthcare now and say, listen, let's just burn it all down and start over from scratch. And that's one option for sure. But you could sort of light the match of that in the hearts of those who might be able to change things while you are still treating patients. Because remember, even though you are trying to burn things down, patients are still suffering, right? So you
Mhm.
have to do, it has to be both and. It has to be carrying forward with regard to treating patients, but it
Mhm.
also, you have to dismantle a huge part of that. And you have to realize that you're in it for the long game, right?
Yeah.
Um,
Absolutely.
yeah,
And if you burn it down, you have to be very thoughtful of what your plan is because at the other side there are people. They're not machines where you can just restart.
that's
No.
absolutely right. Yeah, that's absolutely right. So yeah, you got to be thoughtful. You have to, you realize that okay, as I move on in my life, I got to now pass it on to somebody else because the changes that we're trying to start aren't going to reach completion in my lifetime. That's
Mhm.
just a fact. And so, people like you, Bal, who can really take up that um, uh, uh, that uh, that effort and move it yet forward some more, right? And then you'll be mentor to someone who will move it forward some more. That sort of thing. And so it's like kind of like a domino effect, I suppose.
Mhm.
And yeah, so that's sort of how I view things with regards to being inspired to get up one more day and go out there and try and give others, my patients, hope.
Amazing. And really your what this podcast is all about. We want to raise awareness. So if you're in the Philly region, look up Miriam Medical Clinics. It's run by one pharmacist, one physician. They're trying to pass on because they are in their 70s, and there's a lot to learn from them. There's going to be, I think, years and years still of your mentorship, but we need more healthcare providers. Reach out to us. Uh, Even if we could just get somebody to help once every 6 months, we could be fully staffed because there's a lot of us. A little bit one by one, we can make a difference. Um, so thank you so much for
Well,
that.
well said. Well said.
Yeah. Um, do you have any advice for your younger self, would you say? Like, would there be anything that you would have done differently? We haven't really dived into your past. I definitely want to talk about that. Perhaps in, the next episode, we can talk a little bit about the beginnings of Neil Pitts. But
Sure.
looking back, because some of our listeners may be in their, adolescent years or even 20s, 30s, um, any advice you would have to the younger folks on how to pursue public health?
Yeah, yeah. Yes, look at the landscape of, if you are inclined towards service, if you are inclined towards science, if you are inclined towards making people's lives better through the combination of science and service, um, look at that for sure in your lives. Um, and moving forward. just make sure that it's something that you're falling in love with, right? It's not something that is a job. It
Mhm.
is something that you are doing uh, because um, it's in your soul to do, right? And that's not, not painting too glossy a picture, idealistic picture, really, but it is about, loving what you do. So,
And I have to say that is so important. Um, I never really truly understood why I was in pharmacy, and I think in my time, a lot of people pursued healthcare because they thought that was the stable thing to do.
mhm,
I remember I wasn't really in love with all the courses, but there was one class that I was actually maybe two that I was really in love with, and one was sociology, and the other was anthropology, and it was taught by
mhm,
a nurse. And she came out and she visited indigenous people, Native American folks, and just kind of learn about their the culture and the history and how she can better serve them. But I just thought that sounds really cool, like all the books you read, like or the books that I read. It was just sounded really motivating, but I just never knew how I could have inserted myself into the anthropology section.
mhm,
So that's just a little tidbit about me, but the passion part, I agree, it has to be there. And it's really hard when you just first graduate from high school, you don't know what to do. I see a lot of kids now, they're pursuing more of like a mathematics, engineering degree, rather than a healthcare field, because I think after the pandemic, there seems to be like a steer away from that because they see all the rough life that healthcare professionals have to go through. And then now, even now, like, you mentioned public health and public servant. It's a turbulent time for these, federal workers, healthcare workers, who are in the public health field.
mhm,
Yet I chose to dive into getting a master's in public health. I just started in the fall, and I'm not regretting it because I think it really is a tool for me to pursue it later on in life. It's not about the money for me. It's more about just how much of a meaningful I can contribute in my
mhm,
life.
mhm.
But do you have any insights on folks who want to do public health, but they're afraid that maybe when I get out, there's no job for me, or there's not much of a security there.
Yeah, yeah, that's a real challenge for sure. And I want to say that, and this is so easier said than done. Uh,
Hmm.
you know this about, but creating your own path is really something that people could consider, right? And it's okay. What does that mean? It means looking around you and looking at the vast need that there is for individuals to give others some comfort, right? Because when we go into public health, we're really talking about giving others comfort, right? And so that takes various forms.
Hmm.
In our lives, it takes, my background is in pharmacy, and I sort of morphed to doing this thing in public health, but it's about seeing whether or not someone has a place to live. A lot of folks that we might encounter on the streets have no place that they're going to be laying their heads
Hmm.
that night. Does someone have enough to eat? And if not, how can you lead that person to a resource of food, right? Do they have clothes to wear? We could go on and on and on,
Hmm.
but it's a matter of looking at issues such as that. As far as jobs are concerned, if you love it, you're going to figure out a way to do it, right? And like you and I, we might, you might start out by actually having a um, a regular routine, quote unquote job, but you'll figure out how to do something on the
Mhm.
side that's a service to someone. That's something on the side. You would be surprised. That could explode into something that you never imagined. And that will be your 9 to 5, so to speak, at some point, and you'll wonder, well, I can't believe I'm being paid to do this.
Mhm.
Because because I would do this. This is what I would do anyway. Um, so
Absolutely,
yeah, yeah,
absolutely.
give it some thought, and
Yeah,
sometimes you could create your own path.
and I love that you said that, because when we think of majors, right, like pharmacy, we think of, oh, you'll either work in a retail community pharmacy setting or you'll work in a hospital setting. And then
Hmm.
nowadays, a lot of kids are, steering to pharmaceutical for the, work-life balance. But there's
Hmm.
so much more that you can do, even as a pharmacist. There's so much other avenues that you can pursue that are not being shown to us when we were in school. And possibly it's also because our instructors at the time may not be aware of these opportunities. Like you
Hmm.
said, you pave your own path, and such as like an MPH degree, it's not just, oh, now you have to go and work for the government or you have to develop this program. There's so much more that you can do. Really, I think sky's the limit. You can be creative and look at different avenues like
Hmm.
nonprofit or, United Nations, WHO. Like
Yeah.
it's so many, and we're just not. I think we are just not been exposed to it as a society. I think the people who work in those little streams are not. Being displayed. And that's
Hmm.
really my goal is to find these people and get them to connect on this platform and tell us how they got to their job. And you yourself actually had a very interesting career path. Um, for me, I think I'm doing exactly what you're saying.
Hmm.
I started to be putting myself out there and volunteering for different things, and they are exploding. Now it's just a matter of controlling, where I want to dedicate my attention to.
Hmm.
So we've got the Miriam, we've got a nonprofit called CAFO in West Africa, in Burkina Faso, and then
Hmm.
locally for myself too. Like there's you can even work with the school.
Yeah.
And you had mentioned that if I think it was you and maybe perhaps my next door neighbor had said, if you're not looking for a paid position, they would love to have you because, you know,
Hmm.
and any
Hmm.
help to help our kids, the people, right, like
Yeah.
on the street,
Yeah.
um, is always welcome. You just have to find those places and insert yourself. And nowadays with the intraweb, or interweb, like uh opportunities are endless. You can almost search up anybody. You can
Yeah.
search up yourself, myself, to find out information.
Yeah, that's right. That's right. So yeah, it's a world full of opportunities for sure, and they're not only local. They're international. If one ever has the opportunity, for example, to go on a foreign mission trip, you know, um, Haiti, South America, countries in Africa come to mind. That can lead that literally those kinds of trips can literally set your imagination on fire, and you will never be the same again. And so, um, yeah, put yourself out there and see what's out there that you can grab hold of, and it's life changing. It really is. So,
And you yourself have been to Kenya, right? And that's how
mhm.
you and Dr. Johnson met.
Right,
Um,
right.
would you mind telling us a little bit more about that with your trip?
Sure. I've been traveling to Kenya for quite a while now, And it began when mission team that I was on went to work with Dr. Johnson and his family. And and I'll tell you the truth. When I first went on that trip, I had zero clue where it might lead. For things that I wanted to do, and for the place that I would find myself in, just in the world, I suppose, and in life. But that exploded. That exploded, and I went back again, and I went back after that, and I kept going back, and they kept presenting to me opportunities that I could help. And and I love working with people who are of the same mind. Dr. Johnson was one of those of the same mind, and so he and I have been together now for, we've been partners in crime, as it were, for the last, well, I want to say it's been over 30 years now.
Wow.
And so, and so, we've come this far and, opened up Miriam with our, it's been a family affair, he and his family, me and my wife. And one of my daughters worked for Miriam at one point in time, but yeah, so it's a trip to Kenya, Nairobi, some places on the east coast of Kenya, uh, Mombasa, etc. That really changed my life, and I saw what was possible, not only in Kenya but then bringing what was possible to the need here in the U.S. Right, and
Hmm.
that's really important to yes, you can use what you've been given in terms of inspiration. You can use that overseas, but you can really use it here at home. So
Yeah,
so yeah,
absolutely. So you don't have to wait until your next trip overseas to do something.
right,
There's always opportunities at home as well.
right,
But if there is a chance, take it. No, I agree. Um, it's gonna it, if I think if the opportunity presented itself, I may take that. But it's a little hard, right? Like, so if you're young and you're single, take it. Take it while
yeah,
you can.
yeah, yeah. I mean, it's
Yeah.
challenging for sure. When
Mhm.
when my opportunity came along, my children were in their early 20s, actually, and they were they were in school, etc. And and it kind of freed me up a bit
Mhm.
to take some trips. I was still working, but fortunate enough to have sufficient vacation time that I could do these things, right? So and some of it is structuring your life to allow you to do that, right? So
Mhm.
I was working in like I was working in the pharmaceutical industry, and one of my benefits was a lot of vacation, and so I used that vacation to travel, and my children have been over with me, so it's not like I was not um you know uh, sort of including my family,
Mhm.
so it is. I guess the point of this is that I'm trying to make is it's how you structure your life,
Yeah.
right? And it's how you yeah, how you structure your life, how you envision your life,
Mhm.
talking it over with those that are close to you, with your wife, your husband, your children, etc. Having that support is absolutely critical, absolutely critical. And through that and those kinds of discussions, some decisions are made, and you may decide to go. Your support system may say, "Yeah, go and let's see what we can do in that regard." They may say, "Now's not a good time," and you have to abide by that as well.
Mhm.
Um, So yeah, it's not. We don't travel this road alone. You have to do it with those that have been given to you, and sort of it can work out. It can
Hmm.
work out. Yeah,
Yeah, it just depends on the priorities at the time.
yeah.
And, if you make the time, there's always time. Yep. Well, thank you so much. We have tapped into a little bit about you, but we'll definitely stay tuned to hear more on Dr. Pitts, everybody. With that, thank you.
And thank you so
Yeah.
much. So I really appreciate being with you today.
All right.